Chemistry and Public Health Effects of the Flint River Crisis by Brittany James, Naomi Sally, and Brittany McFarland.
Hello, my name is Brittany McFarland, and I will be presenting the introduction and the chemical contamination details of the Flint, Michigan water crisis. The Flint water crisis began when city officials switched Flint's water supply from the Detroit water system to the Flint River in April of 2014, intending to reduce costs. Originally considered a short-term financial solution, this decision quickly became disastrous due to poor management and oversight. Residents immediately noticed changes in water quality, including unusual color, taste, and odor. Despite community complaints, authorities initially dismissed concerns, which contributed to prolonged exposure. This presentation aims to thoroughly explain the background of the crisis, the chemistry involved, and the critical public health outcomes affecting Flint's population, emphasizing the essential role of healthcare professionals, particularly nurses, played in addressing this public health emergency. Understanding the timeline of events helps understand the Flint water crisis. Flint initially switched its water supply to the Flint River in April of 2014 to cut costs. By May 2014, residents already reported significant water quality issues. Despite these early complaints, officials delayed decisive action until pediatricians revealed alarming data about elevated blood lead levels in children by September of 2015, which drew widespread attention and concern. By October 2015, Flint officials reverted to Detroit's water system in an attempt to mitigate further damage. However, the crisis had escalated significantly, prompting the declaration of a state of emergency in 2016 and initiating numerous legal actions aimed at holding responsible parties accountable for the contamination and its health impacts. The public health consequences of the Flint water crisis were severe and far-reaching. Elevated lead levels affected thousands, especially impacting vulnerable populations such as children and pregnant women. Children exposed to lead face serious risks, including developmental delays, impaired cognitive function, behavioral issues, and learning difficulties. These impacts can persist into adulthood, affecting educational attainment and life outcomes. Additionally, the contaminated water was associated with an outbreak of Legionnaire's disease, a potentially fatal respiratory condition. Between 2014 and 2015, Flint experienced a spike in Legionnaire's cases, resulting in numerous hospitalizations and deaths. Nurses and healthcare professionals became critical in detecting early symptoms, managing health complications, and providing ongoing care and community education about exposure risk and preventative measures. Typically, orthophosphates are added to water systems as corrosion inhibitors, creating a protective scale inside pipes that prevents the release of harmful metals. Flint's failure to add orthophosphate resulted in a severe breakdown of protective barriers within pipes. Flint residents quickly noticed visible signs such as brown, orange, and cloudy water. These visual indicators included rust stains and bad odors. Internal pipe inspections revealed substantial corrosion and scaling, largely due to the lack of corrosion control measures. The discoloration in the water was primarily due to iron and lead particles from corroded pipes. These alarming visual signs significantly increased public distrust in local and state governments, emphasizing the critical importance of preventive measures and transparent communication about water safety. Understanding these visual and chemical indicators is crucial for healthcare providers in identifying and responding to community health risks effectively. Chemical contamination in Flint stemmed largely from aging infrastructure. Many Flint homes have pipes containing lead, a toxic heavy metal. When officials switched to Flint River water, critical treatment steps to control corrosion were skipped or inadequately implemented. Flint River water was significantly more corrosive due to its low pH levels, resulting in accelerated degradation of the pipes. The pH of water directly affects the solubility of metal ions like lead, and acidic water contains higher levels of hydrogen ions, which degrade the protective coatings on pipes. Lead in pipes reacted chemically with water according to the reaction, releasing lead ions into the drinking water. Normally, orthophosphate, a corrosion inhibitor, is added to water supplies to maintain a protective scale inside pipes. Flint's water did not initially receive orthophosphate treatment. Without this corrosion inhibitor, The protective scale deteriorated rapidly, further accelerating lead contamination. Acid-base chemistry played a crucial role in the Flint water crisis. The Flint River water had significantly lower pH level, meaning it was acidic and highly corrosive compared to the previous water supply from Detroit. Lead is typically insoluble in water unless conditions are acidic or if it is exposed to oxidizing agents like chlorine and oxygen. Acidic conditions increase solubility of lead ions, which then enter the water supply. Once ingested, lead ions can enter the bloodstream, mimicking calcium ions, leading to disruptions in neurological, muscular, and renal functions. The EPA has set a safe limit of lead in drinking water at 15 parts per billion, but the Flint water far exceeded these limits during the crisis. Understanding the specific acid-base reactions that cause pipe deterioration and contamination helps nurses grasp the depth and complexity of chemical exposure, informing their clinical assessments, patient care plans, and community education efforts.
The Flint water crisis occurred when the city replaced Detroit's treated water supply with water from the Flint River without implementing corrosion control measures, resulting in a decrease in water pH and increased corrosiveness. The acidic water from the source accelerated the deterioration of aged lead service lines and galvanized pipes, which led to toxic lead contamination in drinking water supply. The toxic effects of substance also causes metabolic acidosis, which primarily affects children. The breakdown of acid-base balance in the bloodstreams occurs when lead damages the kidneys because these organs serve as the body's main acid-base regulators. The reported symptoms of fatigue and irritability and confusion in Flint may stem from these psychological disturbances. In the next 5 slides, I will be talking about pH acidosis. In April of 2014, the city of Flint switched its water source from Detroit's treated supply to the Flint River. The river water had a lower pH, making it more corrosive. The water from the river stripped away protective mineral layers in old pipes, which led to the release of lead and other metals into the water supply. The water crisis began here, and it became a starting point which led to major public health consequences. A decrease in pH results in water becoming more acidic. The water in Flint became more acidic due to which it dissolved lead from service lines that were already old. The water supply became contaminated as it entered homes, thus creating a major public health crisis because families were exposed to dangerous levels of lead. The proximal tubules of the kidneys become less efficient at acid-base regulation after lead exposure continues for a long period. Excessive acid in the bloodstream develops when patients suffer from metabolic acidosis. The condition leads to multiple symptoms, including fatigue and irritability and delayed child development. The number of children with elevated blood lead levels rose dramatically between 2013 and 2015, particularly in areas with lower economic status. Early detection, along with proper intervention, became essential because the prolonged exposure caused neurological delays and irritability and fatigue and learning disabilities in children. The combination of acidosis and other health issues result in deteriorated bone mineralization alongside damaged kidney function and brain development problems. The lead contamination in Flint created dual disasters since the environmental crisis became a public health emergency and a critical issue for nursing care. The Flint case demonstrates to nurses how environmental chemistry creates direct impacts on public health. The first healthcare professionals who detected abnormal lab results, including low serum bicarbonate and elevated blood lead levels, were nurses. The nurses performed duties that went beyond medical practice by advocating for the public while conducting investigations and teaching community members. Nurses who understand environmental risk factors including water, pH, and contaminant exposure will provide effective responses to health crises with will provide effective responses to health crises in undeserved populations. The next 5 slides will discuss its connection to nursing. Medical professionals who are nurses must identify both lead poisoning and acidosis during early stages. The process of monitoring requires close observation of blood gases together with urine pH levels and electrolyte measurements. The nurse needs to detect clinical indicators of fatigue and irritability while working together with physicians to provide urgent medical care. The workforce of nursing professionals maintains essential duties for public health surveillance activities. The nurses take part in lead screening programs while teaching families about water risk and linking patients to evaluation and follow up testing resources. Through their work, nurses link clinical activities to community health care services. Water contamination education forms an essential part of nursing practice because it teaches families about water contamination risk. Nurses educate families about screening importance while showing them what long-term effects to detect and how to minimize exposure in order to develop trust and enhance health results. Nurses possess the power to generate substantial change which extends past direct patient care responsibility. Nurses work with public health departments and policymakers to create policies which safeguard communities and support both remediation initiatives and extended funding for monitoring and prevention programs. Environmental health literacy serves as an essential knowledge base which nursing practice requires according to the Flint crisis experience. Nurses will grasp environmental toxins' effects on acid-base balance and patient results can better serve patients by providing education and risk detection and by advocating for protective community policies.
My name is Brittany James, and I'll be going over the affected demographic, affected organs, and conclusion, and touching upon some things that nurses can do to promote clean and healthy drinking water. The city of Flint was already in financial distress years before this particular crisis even happened. Before the Flint water crisis, it was estimated that 140,000 individuals were exposed to lead and other contaminants in the drinking water. Lead can lead exposure can damage children's brains and nervous systems, lead to slow growth and development, and result in learning behaviors, hearing and speech problems. After the involvement of concerned residents and independent researchers, Flint was reconnected to the Detroit water system on October 16, 2015, but a federal emergency was not declared until January of 2016. To get a better understanding of why this crisis occurred, let's dive a little bit more into the chemistry. If you take a look at the pipes, we have One picture representing Flint before the water was treated, and then we have the other picture representing when the water was treated afterwards. Before Detroit waters was treated, phosphate corrosion inhibitors help to maintain a mineral preservation layer on the inside of the Flint pipes, protecting them from corrosion. With little corrosion, chlorine disinfectant levels remain stable. If you go over to the picture on the right, this was after the water was treated. Lack of corrosion inhibitor, high chloride levels, and other factors cause the preservation layer to dissolve and fall off, leading to increased corrosion in Flint's pipes. As the pipes corrode, chlorine disinfectants breaks down. Oxidants such as dissolved O2 corroded the pipes and leach soluble metals. When Flint changed its water supply in 2014, the city didn't adequately control the corrosion, resulting in its water woes. Some of the social and economic impacts included psychological trauma. Residents experience fear, anxiety, and loss of trust in the government and public health authorities. Increased cost of water infrastructure. The crisis led to a significant spending on replacing lead pipes and improving water quality infrastructure. Educational outcomes. Decreases in math achievement and increases in special needs classification were observed in Flint school-age children. Legacy of distrust. Many residents still refuse to drink the tap water even after remediation efforts, and a lasting legacy of distrust still remains. Now that we recognize how fragile our water system can be, it is a must that nurses advocate, and it is crucial that our regulatory systems protect our clean drinking water. Nurses need to be aware of the challenges that impact our water supply in our community and how they jeopardize our health. We hope that this will be a starting point for all of us as future nurses to become leaders. To conclude our presentation, scientists from the University of Michigan Ann Arbor unequivocally confirmed that this crisis was 100% preventable. The use of orthophosphate in the drinking water treatment process could have prevented the health crisis and the contamination of hundreds of Flint residents. In addition to this development, the Environmental Protection Agency would forgive the debt of $20.7 million, which was a debt owed to the federal government from the city of Flint in a they wanted to help the people recover in Flint. Flint now has clean water, but the relationship that Flint residents have with the water is complex. After being told over years that contaminated water was safe for consumption, Flint residents have developed a deep mistrust for both the water supply and the local government. The Michigan Attorney General did bring criminal charges against the Michigan Department of Environmental Quality. Some of the employees and the Flint City Utilities administrators in April 2016 had promised that additional cases would be brought over time. In June 2016, more than 2 years after the switch to the Flint water and 8 months after the return to DWSD water, the EPA announced that the water in Flint was once again safe to drink, provided that the National Science Foundation approved filter was used to remove the remaining traces. As the criminal investigation progressed, more than a dozen of local and state officials were indicted on a raft of charges, including obstruction of justice, lying to the police, and involuntary manslaughter. While prosecutors were able to secure misdemeanor convictions against 7 defendants through the plea bargains, the most serious charges were dropped in 2019.